A simple blood test could screen for Alzheimer's disease even before a patient has any symptoms. Right now, that type of testing usually involves brain scans or spinal tap. But the study found this new blood test was just as accurate. The test is just for research right now, but could be available for clinical use soon.
Yeah, a lot of people interested in this morning. And joining us to break it all down is our 9 News medical expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning.
What impact could a test like this have?
You know, what an incredible impact, because we have 6 million Americans living with Alzheimer's, and that's expected to double in the next couple of decades. And the number of Americans with cognitive decline that go undiagnosed is just incredible. And that's because it's so hard to do these tests. We have to do brain scans, we have to do spinal taps. It's inaccessible. And also because we have to wait for symptoms to occur, the cognitive decline, the memory issues, and then we think about doing the test. So this turns that thinking on its head, and we start being proactive and saying we're going to start screening, just like we screen for heart disease. We're going to screen for dementia with a simple blood test, and we can tell if you might go on to get Alzheimer's.
From what I understand, they're testing for a protein in it, right? How does the test work?
Yeah, so it's a blood test that looks for a protein called p-tau, or phosphorylated tau. And tau is one of those kind of junky proteins that builds up in the brain. Now, what we know in Alzheimer's disease is that these proteins start to gunk up the brain, tau and another one called beta amyloid, many, many years before you start having symptoms. So deposition of the proteins in the brain is then what many years later turns into symptoms. So if you can start detecting them in the blood early, before you have those symptoms, you could maybe think about implementing therapies early when the disease is modifiable, rather than waiting till it's very, very advanced.
I want to go back to what we were talking about with the accuracy of this test, because a lot of people are going to be wondering how correct it is.
Yeah, so very accurate, and that's what's been really exciting about this test. 97% correlation with proteins. But here's the kicker and the caveat on that, is that not everyone who has these proteins is going to go on to get clinical Alzheimer's. So now we're starting to ask a little bit more ethical questions. In other words, if your test comes out positive, but then you never go on to develop Alzheimer's, and we don't yet know who will and won't, then firstly, should we even be doing the test? Because it changes your life, of course, and your thinking, your behavior. And secondly, how should we be treating those people as opposed to the ones that do go on to have Alzheimer's? So this is almost what I would call a false positive, you know, for Alzheimer's syndrome, because the proteins are there, but they may not get the clinical characteristics of Alzheimer's. So what we should do with those remains a little bit of a question.
All that being said, though, I mean, I kind of want to go out right now and get the test to see if I have the protein. What age should people be getting this when it becomes available?
You know, so it's research only right now. We have to figure out where that sweet spot is, because again, you don't want to tell somebody in their 20s or 30s that they're going to get Alzheimer's. It could change the way they think about their life. On the other hand, you could work harder on their other risk factors: alcohol, sleep, cardiovascular disease, all the other things that cause dementia. So I think we're going to probably start screening middle-aged adults when it does become clinically available, but that's something we need a little bit more research.
We have 10 seconds left, but I want to ask, when this does become available, is it going to be affordable for people to use?
They're guessing, the company says, about $200 to $500 for the test. And I would imagine it wouldn't just be a one-time test, because you can get buildup of those proteins. So just like we do with heart disease, it would probably be every few years, 3 to 5 years, you might want to check it, something like that.
Considering in the realm of medicine, that's not too bad.
Yeah.
You know, I mean,
and for a life-saving, you know,
Exactly.
But what the implications would be for insurance coverage and all that, we really would have to make sure we keep those insurance companies' feet to the fire and don't allow them to deny you coverage or anything like that because your test comes out positive.
Yeah, all right. Well, Dr. Kohli, thank you for your time. We appreciate it. Let's get a check of your forecast now with Chris. Oh, actually, really quickly, we can't forget this part. If you like what you hear from Dr. Kohli, and of course we know you do, you can actually find all of her appearances and more information on 9news.com/Dr. Kohli. Now, Chris.